All right, Dr. McGaw, the research trials. Tell me a little bit more about that. You probably need more of a thorough explanation, don't you, on that?
I think so. The patients often leave this community to seek out experimental therapy or new innovations in therapy. And patients do that for multiple reasons. Some are not satisfied with what the standard treatment is. Some want to participate in research to benefit their grandkids, so to speak. What it does is it allows patients sometimes access to therapy that's not quite yet standard or approved by the FDA. It may or may not be better than what the standard therapy is, but some patients just want to be on the leading edge. We can now participate in clinical trials here. We have over 30 open trials, and we welcome patients to come see us and talk to us about that.
Okay. When you say the word comprehensive, and we hear this a lot as a medical term, when you say comprehensive cancer center, what specifically does that mean, Doc?
Well, the treatment of a cancer patient, probably more than any other illness, involves many different modalities and subspecialists. For instance, the diagnosis may involve the family practitioner. Most solid tumors require surgery. A surgery gets involved. Pathologist, who's the physician who interprets the biopsy, gets involved. The oncologist, like myself, will provide medical therapy, either oral medication or intravenous medication. The radiation therapist provides radiation therapy. So it requires several specialties.
Okay. Technological advances. We hear that term used quite a bit too, and I know in the cancer center is no different. What kind of advances are we looking at?
Well, Mary Bird Perkins and Terrebonne General are investing over $5 million in purchasing new equipment and services. Prime amongst that is going to be our new radiation therapy unit with IMRT, which is a way of delivering radiation therapy which allows you to give the patients larger doses in a focused area with minimal damage to surrounding tissue. We're also going to have in our comprehensive cancer center a PET scan unit, which is a cancer scan which can tell you whether abnormalities you see on a CAT scan are actually malignant or scar tissue.
Okay. Services for the community, Clark, between Mary Bird Perkins and Terrebonne General Medical Center. What kind of services can you offer the community as a whole?
Absolutely, and it is important for a comprehensive program to offer these services. And I would say primarily, as we were mentioning, some of these patients need these support services. And currently we're involved in things like Bosom Buddies, which are for breast cancer survivors. We are involved in a group called Nosotros, which is spearheaded by one of our physicians. It's for families and for patients who are going through cancer treatment currently or have survived cancer treatment. We're involved in Look Good and Feel Better through the American Cancer Society. One of their representatives performed that leadership role over at our outreach center over at the mall. That's very important because we have a cosmetologist on hand for all those meetings to help with makeup and hair and those sorts of things for folks who've gone through cancer treatment. Okay. Also, we're involved in Cancer Survivors Day. It was an event that we just had several weeks ago, enjoyed by approximately 200 cancer patients and loved ones. Each cancer patient could bring a family member with them. We had featured speakers, and it was a time of fun and relaxation. So I think they enjoyed that very much. Okay. I will say, as far as the community outreach as well, we're involved in Ladies' Night Out. You may have heard of that, Martin. Yeah. It has somewhat become a staple, I think, in our community here. This year we had in excess of 700 participants, I believe.
I know Rhonda in marketing worked very hard on that.
Absolutely. Yeah. And next year we're shooting for over 1,000.
Really?
So very, very important activity for us every year. Of course, Susan G. Komen, Race for the Cure. Over 2,000 participants last year. Will be involved again this year in October. That's Breast Cancer Awareness Month, of course. Relay for Life, again, working with the American Cancer Society. Over 2,000 folks were involved this year. We anticipate growth again next year. Okay. So it continues to grow. Right. And we're also involved in some screenings in the community as well.
Tell me about the early bird program. There's a bus that goes out and does a screening I guess, a tour or something. I'm not sure what it does. But tell me about the early bird.
That's another important component of our program. It is called the Early Bird. It is a large, for those who are listening who have seen this, it's a large bus that allows us the opportunity to go to areas, to go to the people, and to provide. We've done colorectal. We've handed out colorectal kits. We've done prostate screenings. We've done breast screenings, as well as skin cancer screenings. So it's an important avenue for us to get out and to touch the people. Last year, again, we were looking at the numbers. Approximately over 600 were touched last year with those services, and we're growing this year.
That bus idea is a good idea.
I think that it is. Again, it's with cancer treatment and early detection and so forth, we think it's very, very important to get out there early.
All right.
So hence the name.
There you go, Early Bird. Dr. McGaw, we'll let you close it out. Your comments about the building to close the program.
Well, I've been practicing cancer medicine and terrebone parish for 20 years. And on the one hand, it's disappointing that we had to wait this long for all the factors to come together like this. But maybe all things come to those who wait. And it really does, and in all sincerity, look like we have the right people now. The hospital is committed. I've never seen so much enthusiasm from the hospital personnel. Mary Bird Perkins out of Baton Rouge is a first-rate organization. And I think the 3 oncologists do a good job. And our goal really is to provide first-rate, world-class treatment in home so patients will not have to feel like they have to travel out of town to get treatment.
Well, congratulations and a job well done.
Thank you very much.
We appreciate you being here tonight.
Thank you.
All right, we're going to take a break. When we come back, In the Kitchen with Canadas, you won't want to miss it. Don't go away.